Good evening, everybody. Welcome to my channel. My name is Jose Negron, and this is another episode of Uncommon Sense. On tonight's topic, we're going to be having discussions regarding COVID-19 mandates. Do they help or hurt? In tonight's episode, what we will be doing is we will be having discussions trying to separate truth from fiction. Because unfortunately, there's been a lot of misinformation given regarding COVID-19. Now, what I like to do is I like to give definitions, so therefore there'll be no misunderstanding or confusion. Now, COVID-19 is also known as the coronavirus. And what is COVID-19? It is a respiratory condition caused by a coronavirus. Some people are infected but do not notice any symptoms, of which doctors call that asymptomatic. Now, here are the most common symptoms to COVID-19. Fever or chills, a dry cough and shortness of breath, feeling very tired, muscle or body aches, headache, a loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Those are some of the symptoms. Now, what I'm going to do is I'm going to post a link so anyone can join in. Now, let me just explain to you. Tonight, I'm going to be on YouTube, Facebook, and Periscope. Now, for some reason, the link did not go through on Periscope. This is not the first time I've been having a problem. I do not understand why. Well, in any case, for those who are watching on YouTube, the link is there. Should anyone wishes to join the link. Now, let me just give you some other information. As of today, 680,652 people in this country have perished due to COVID-19. Now, that is the size of a large city. Also, let me just give you some other figures. Now, the 5 leading states where there have been the most COVID deaths are as follows. Number 1, California. Number 2, Texas. Number 3, New York. Number 4, Florida. And number 5, Illinois. Now, I'm going to be speaking mainly as it pertains to New York City. But in many other cities, there are similar mandates. Right now, in New York City, in order to dine at a restaurant or go to the gym, you must be vaccinated, meaning you must at least gotten the first dose. Unless you have been vaccinated, you cannot gain entry. And the fact of the matter is, whenever you go to a restaurant or whenever you go to the gym to work out, you must show proof that you've been vaccinated. Now, what some people will do is they will carry their immunization card. On the immunization card, it will list the date or dates where they receive either the first dose or both doses, with the exception of Johnson & Johnson, of which there's one dose. Also, there have been various different apps that have been created to show your immunization record. One of them is the New York Excelsior Wallet. Another one is the New York City COVID Safe application app. And the whole purpose of that is for those who do not want to carry their immunization card. They can show proof of immunization to whenever they go to the gym or when they go to a restaurant to eat. Now, recently, Mayor de Blasio has removed social distancing from places of employment for municipal employees, meaning that you don't have to keep 6 feet distant from others. In my opinion, that's massive insanity, considering that we're dealing with the Delta variant, considering the fact that there's been an increase in COVID-19 cases. And because recently on my floor where I worked, 2 employees got infected by COVID-19. And that caused a great deal of concern among the people who work on my floor. As a union delegate, I advise members the following. Please wear a mask that covers your nose and mouth completely when you are away from your desk or you are in an area when you have to share space. Make sure that you sanitize your workstation. In other words, you take wipes and you wipe your desk, your phone, your computer, your keyboard. Also, you wash your hands for 20 seconds. And it does not hurt to carry hand sanitizer. Now, I'm going to show you again the proper way to wear a mask. So what you're going to do is you're going to put this here. Okay? This is the proper way to wear a mask. Not this, not this, this. With this pinched in like that. What it does is reduces the exposure to COVID-19. Because the reality is this. You do not know who's been vaccinated or who not been vaccinated. Also, you do not know that there might be people who have COVID-19 but show no symptoms. They may be asymptomatic. Now, the proper way to remove the mask is this. Okay. Also, recently, Mayor de Blasio stated that as of September the 27th, all employees of the Department of Education must receive at least the first dose of the vaccine, which led many of the unions to sue the city regarding having COVID-19 mandates without discussion with the unions. It is understandable that the mayor is trying to do what's possible to prevent anyone from being exposed to COVID-19. But there's a right way and a wrong way. The right way is you discuss it with the unions, you come up to an agreement, you come to a consensus where you develop protocols that we can live with to reduce the exposure of COVID-19. Now, the fact of the matter is, first of all, there are people who are medically unable to get vaccinated because of some sort of health issue that they have. Also, there are people that don't feel comfortable about getting the vaccines because there is a great deal of mistrust. One of the issues that people have that being reluctant to get the vaccine is the speed or the apparent speed where they've been approved. And let's keep it real. With the exception of Pfizer, the other two vaccines have emergency approval. And the truth of the matter is we do not know all the facts regarding the vaccines. And let's keep it 100. Getting the vaccines does not mean that you will not get COVID-19. What it means for most people who are vaccinated, if you do get the coronavirus, the symptoms would not be so severe. But unfortunately, there have been some people who have gotten the vaccines and died. Okay. Now, unfortunately, ever since the onset of the pandemic, there have been a great deal of misinformation. Also, the fact that there have been people who have shamed others. First of all, you have those who got the vaccines shaming those who choose not to get the vaccines. And then you have those who didn't get the vaccine shaming those that did. I said this before, and I will say it again. Any concerns that you have, please discuss them with your primary care physician. And please make sure you ask questions regarding the symptoms regarding COVID-19, questions regarding any of the vaccines, and also questions regarding the symptoms. And then based on that information, you decide what you're going to do. And I repeat, you. It shouldn't be Jose Negron deciding for you. It shouldn't be your spouse deciding for you. It shouldn't be your loved ones. It should be you, because you're the one that has to deal with the conditions with your own body. Now, I find it hilarious when I hear anti-vaxxers say, my body, my choice, but yet they shame those who get the vaccine. Let me just see what this person has to say. Okay. With that, I only got to say the following. Any concerns? Discuss them with your primary care physician, and then you decide. Let me make this perfectly clear. I'm not saying get the vaccines. I'm not saying don't get the vaccines. What I am saying is the following. Get the information that you need from qualified medical staff, and then you decide. If you decide not to get the vaccines, fine. Please do yourself a favor and do everything possible to reduce the exposure to COVID-19. That's been my message since the beginning. And unfortunately, people have politicized this. And what's a perfect example of this? All throughout the pandemic, you have seen our mayor and our governor, well, former governor, butt heads over what to do regarding COVID-19. And it's unfortunate because when you take into effect what happened 20 years ago on 9/11, you have the mayor of the city of New York and the governor of the state of New York working together to try to come up with solutions to deal with the after effects of the terrorist attacks. Unfortunately, that's not been the case here in New York. And unfortunately, in states like Texas, Florida, states that are run by Republican governors, you have states where they refuse to maintain mandates because wearing masks. In fact, in Florida, the governor wants to penalize towns for putting mandates and fining people. Why? Just because they're trying to protect people's lives. That's crazy. Okay? That is crazy. I see that there's two people here. If you like to join the stream, by all means do so. All I ask is please let's keep it respectful. And the fact of the matter is, we can agree even when we disagree. All I'm saying is this. Let's try to bring some logic back into this crisis. Instead of spreading rumors like there are microchips in the vaccines, instead of shaming people who, for whatever reason, choose not to get the vaccines and shaming people who did, let's try to get the facts. And then you decide what is your choice of action. That is all I have been saying. Okay? Because the fact of the matter is, I cannot tell what's good for you because I'm not you. All I'm just trying to do is bring some logic into our health crisis that's been politicized from the beginning. Now, what I'm going to do is I'm going to play a little bit of music. Okay, we're back. Now, excuse me. Now, I have developed some other habits which I've done to try to deal with COVID-19. Of course, the obvious is wearing a mask that covers my nose and mouth completely. Also, social distancing, um, washing my hands for 20 seconds. I also carry a bottle of hand sanitizer, and I make sure I bring extra mask with me because they do get soiled. Also, when I do grocery shopping, I try to use a debit card. So therefore, um, I don't have to hand money to the clerk. And on those occasions, when I do have to use paper currency, I'll just hold a tiny tip of the currency, paper currency. So therefore, um, I believe as much room as possible. I'm going to give you an example. Like if I'm going to give person money, I'm just going to grab it by the corner. So that leaves all that space there for the person to grab And that person hopefully will not be touching my fingers. So, if anyone wishes to join the stream, by all means, do so. The link is there. Otherwise, I'm going to end this pretty quickly. But let me just give you my thoughts about the mandates. We are dealing with a health crisis, of which almost 700,000 people had died in this country. We're dealing with variants of the disease. Also, we're dealing with people who have been treating this health crisis seriously. I do agree that we need to wear masks. We do need to practice social distancing. We do need to be cautious. And we do need to be tested on a regular basis. Now, as far as the vaccines are concerned, again, that is totally up to you. Do not let anybody shame you to get the vaccines if you do not feel comfortable about it. Do not let anyone shame you for not getting the vaccine if you wish to get them. Now, before I go, let me just talk about there are some serious symptoms of which you are experiencing. I would suggest you get your butt to the ER, which are trouble breathing, constant pain or pressure in your chest, bluish lips or face, sudden confusion, or having a hard time staying awake. If you experience any of these symptoms, get medical attention immediately. And when I mean immediately, I mean immediately. Do not wait to see that you get better. Do not wait to think, oh, you just sleep it off, you'll get better. Because the fact is, 680,000 people have died so far of this pandemic. So, that being said, it looks like no one is going to join the stream. So I'm just going to wrap it up with the following statements. COVID-19 mandates, when properly and accurately applied, can help. When they're not properly applied, they can hurt. And unfortunately, we had two extremes. We have one extreme where they don't want any mandates at all and treat this health crisis as a joke. You have those who are at the other extreme that insist everybody must be vaccinated. But the fact of the matter is, we should not be imposing our will on anyone. We should not force people who do not feel comfortable to get any of the vaccines if they have legitimate concerns. And the fact of the matter is, we have people who do not trust our government. So that's my take on the mandates. I thank you very much for giving me your time, even if it's only one or two people. I thank you if you're going to watch the stream on the playback. You will be notified soon when I do another live stream. It will probably be at least a week. And I just want to close with the same way that I close all the time. People, let's be careful out there because we're still dealing with COVID-19. And the fact of the matter is, we must do everything we can to minimize our contact with the mentally and intellectually challenged. Because if we fail to do so, we will be infected by their stupidity and massive insanity. Thank you very much. Again, this is been Jose Negron, wishing everyone a blessed night and peace.